Res ipsa loquitur. The thing speaks for itself. It's basically a principle that means if there is an accident, there was negligence, like there is assumed negligence. The thing speaks for itself. Principle that the occurrence of an accident implies negligence. RUQ, right upper quadrant. Right upper quadrant has the liver, the left or the right kidney, the colon, the pancreas, the gallbladder. And the gallbladder is what is unique to the right upper quadrant. Let's see what I missed. Oh, I got it all. Left upper quadrant, we've got the liver, because that does cross the midline, the left kidney, the colon, part of the pancreas, the stomach and the spleen. The stomach and the spleen are the two that are unique there. Let's see. Okay, so the spleen is right under the liver. The stomach is right under the kidney. Right lower quadrant, you've got the right kidney, colon, small intestines, the appendix is going to be down at the bottom. You've got the major artery and vein for the right leg. I'm forgetting something, I think. Oh, the ureter and the bladder, yeah. The left lower quadrant, you've got the left kidney, the colon, the small intestines, the major artery and vein to the left leg, and the ureter and bladder. Supine, that means on your back. Prone means laying on your stomach. Recovery position is laying on your left side with your knees bent and the head propped, usually on the arm, or often on the arm. Oh yeah, preferred for any unconscious non-trauma patient and pregnant patients. Fowler position is sitting straight up. Semi-Fowler is the patient is seated, but in a slightly reclined position. Mid-clavicular lines. These lines separate the chest into regions, and because there are two clavicles, there are two mid-clavicular lines. Mid-axillary line, it's an imaginary line that runs from the armpit down to the middle of the ankle bone. Medial means closer to the torso, I think. Closer to the midline, yeah. Lateral, further from the midline. Bilateral, both sides. Unilateral, one side. Anterior or ventral, that is the front. Posterior or dorsal, the back. Superior, this is vertical, talking about above. Inferior, vertical, below. Proximal, that is meaning closer to the torso. Distal, further away from the torso. Palmar refers to the palm of the hand. Plantar means the palm or the sole of the foot. Anatomic position is a supine position if they are laying down with the palms facing forward, head straight forward. Anatomy is the study of the structure of the body. Physiology is the study of the function of the body. Special reporting requirements. This can be child abuse, elderly abuse, domestic abuse, violence such as pew-pew, wounds, or stabby stabs. Let's see. Injuries on mentally incompetent patients. What else am I missing? Oh yeah, SA. Situations where restraint are required. Intoxicated individuals with injuries. Check, human trafficking as well. Check your local laws and protocols. Preservation of evidence. Remember what you touch. Work with the police. And, minimize your impact on the scene. Negligence. You have a duty to act. Breach of duty, and you have to prove proximate causation. Patient may refuse care or transport. They have to be alert and oriented ×3. They have to be competent. They have to be legally allowed to refuse transport, such as they can't be minors or unconscious. They have to have informed consent to refuse. Legally able to consent, alert and oriented ×3, fully informed, and they have to sign a refusal or a release. Involuntary transportation usually requires like a court order, or they're a danger to themselves or others. You're going to want, if you don't have a court order, you're going to want police involvement. If you have to restrain them, make sure their well-being is taken care of at all times. Yeah, usually decision by mental health provider or police. Expressed consent has to be informed. Implied consent means assumed consent, like somebody is unconscious and is in life-threatening situation. Scope of practice is what you can do. Standard of care is how you should do it. Incline drag, always head first. You don't want their head bouncing off the stairs. Firefighters drag, tie their hands together, slide your head through that space, straddle their body, keep the patient's head as low as possible. Yep. Stages of grief, denial, anger, bargaining, depression, acceptance. Denial, anger, bargaining, depression, acceptance. Yep. Critical incident stress debriefing, usually within 24 to 72 hours. This is to help the first responders diffuse after a critical incident. Escape curriculum. Every patient. Social support. Choice and control. Anticipate. Plan and organize. Every time. Eustress. Positive stress helps a person perform. distress, negative stress, causes signs and symptoms in the responder's well-being. Cumulative stress reaction is caused by low-level triggers, multiple of them over a period of time, also known as burnout. Delayed stress reaction, aka PTSD. You don't usually see signs and symptoms until long after the incident. Requires intervention by a mental health professional. Acute stress reaction. You see signs and symptoms not long after the incident. May require intervention by a mental health professional. Stages of stress. First stage is the fight or flight response, the alarm response. Second stage is the coping one. What is that called? Oh God, can't remember, but it's essentially coping. Third stage is exhaustion, where the person loses the ability to basically deal. Alarm reaction, fight or flight, stage of resistance, that's what it was. Exhaustion, loss of ability to resist or adapt to the stressor. Ryan White Care Act, that is the act that allows EMS providers to be alerted if they have been exposed to a potentially life-threatening disease. There is airborne and bloodborne. Hepatitis B and C. B has a vaccine, C does not. Hepatitis is a virus that causes the inflammation of the liver. It can live on a surface in dried blood for several days. Very contagious. Tuberculosis, it is airborne. It infects the lungs, highly contagious. AIDS, I don't make the curriculum. It is caused by the HIV virus. HIV attacks the immune system. AIDS is the set of circumstances that develops when the patient's body has been attacked by the HIV virus. It's usually spread by blood contact, blood to blood. Yep. Lower risk than hepatitis, B and C, and tuberculosis. Ebola, U.S. was getting infections in 2014. It is spread by respiratory droplets. There is a lack of definitive care for this and has a high rate of blood and bodily fluids, not respiratory droplets. Severe acute respiratory syndrome, aka SARS. This is respiratory droplets. Middle Eastern respiratory syndrome, aka MERS. This is usually found in the Arabian Peninsula. Avian flu, avians, aka birds, to humans. It is a low risk of human-to-human transmission.